It's 11:03 a.m. now, and today we are here for, again, as I mentioned, IDEA's first webinar. It's a dramatic time for Malaysia and the world. I think everyone is feeling the effects of this global pandemic. Thank you all of you who are joining us this morning. Thank you for taking the time to join us. Today we're discussing the economic impacts of the ongoing COVID-19 crisis. Now we know that the government is trying to strike the very difficult balance between defeating the virus while at the same time knowing that these measures will also have a significant impact on the economy. And we are seeing some of these effects already. I think our panelists will be better prepared to answer. In Malaysia, we know that the MCO has now been announced by the Prime Minister to continue until 14th of April. And he also indicated there's a possibility of extending beyond that. So we must all ensure that at the moment we learn the lessons from the last 10 days. What have we learned? And ask the critical questions of our government moving forward as well. So with me today, I'm delighted to have 4 excellent panelists who are going to help us unpack this discussion. I think I'll introduce all of them now, and then later when they come on, I'll just refer to them immediately so that we can get straight into it. So first we have Christopher Chung Wing Wai from Khazanah Research Institute. Now Chris is a Deputy Director of Research at KRI. His research interests pivot around poverty, inequality, and exclusion in the context of economic growth and social spatial processes. He's been really prominent in the last 10 days, urging the government to put in place stronger social safety nets, and we look forward to hearing his latest thoughts. We also have Rachel Gong from KRI. Okay, let me do this. I will say your names now, and then I'll introduce your backgrounds later so that it doesn't get too long. But we have Rachel Gong from KRI, we have Carmelo Ferlito, an IDEAS Fellow, and also we have from Singapore, Dr. Jayant Menon, currently a visiting fellow of the ISEAS-Yusof Ishak Institute, formerly from ADB. I'll go into a bit of their backgrounds later. But for now, let me first hand over the screen to Christopher Chung, and he will jump into his point of view. And I think each of them will be given about perhaps 8 minutes or so to speak. And to Chris, I would like to ask, you know, maybe you can give a short breakdown of what the government has done so far, and how do you think the government can continue ensuring that social protection is adequate as people face, you know, significantly falling incomes, and what are the gaps in current government policy as well? Okay, so I will now, let me see, sorry, I'm supposed to put this on Chris now. Okay, there you go. All right.
Okay, thanks Tricia for the introduction, and thanks IDEAS Malaysia for inviting me to speak. And a big hello to all the audience out there. I saw the list and there are some familiar names, so very glad that you can join us as well. I guess by way of introduction, maybe I'll just start off by saying that I think we have to think about this current economic challenge that we are facing as something that is very different from previous economic recessions that we have seen, whether it is the 97 Asian financial crisis or the 08-09 global financial crisis. And I think because this is actually driven by a pandemic, it's actually caused by COVID-19, which requires people to stay at home. And I think that inevitably will result in people not being able to contribute to production. And even if they are able to work from home, I think productivity will be impacted. And also, I think the shocks that are coming in to the economic system right now is not just a shock that is from the demand side, but it's also a shock that's coming from the supply side in terms of disruptions in global supply chain and all that. So which is why I think I have called for a shift of our thinking in terms of strategy of how to deal with the economic challenge. It's not really to think in terms of our conventional way of wanting to stimulate the economy using our conventional policy tools of wanting to increase aggregate demand, to get people to consume and to spend. But really it is about putting in place a protection strategy which is what I call to protect the productive potential of our economy. And I think for a few reasons, in the sense that one, we have to recognize that our workers, our firms, our productive assets at this point is not inherently unproductive. I mean, they are staying home because they want to avert a crisis. And I think that should be the priority right now. And I think second, the kind of economic linkages between employers and employees are something that have been built over time, and it's valuable. And so we want to prevent the economic linkages from being destroyed as well. So I think, which is why we want to protect this productive potential from it being, from seeing our economic system descending into some kind of systemic collapse and the destruction of these economic linkages later on. And I think it also allows, I think, our productive potential to be able to bounce back faster so that we can restart production when the crisis is over. And I think one of the central sort of element of this social protection strategy is a massive employment retention program. So the government actually has introduced one version of that right now, which is also called the ERP, which is under the, I think they tagged it to the EIS, which is our unemployment insurance system, which is at the moment a very small scale program because it targets 3,000 workers. It is a payout of 600 ringgit over a period of 6 months. And I'm really not sure if that is adequate. But I think the idea of having a massive employment retention program, it's really about government coming in to provide wage subsidy to employees, or it can be even some kind of a wage sharing mechanism between employers and employees. And when I talk about the employment retention, a lot of times the feedback I got is that you shouldn't just be taking care of workers, but you should also be taking care of the firms at this point. And I think that is a misconception of what the ERP is all about, because the employment retention program is really about addressing the economic linkage, about preserving this linkage between the employer and the employee, by allowing to recognize that actually firms, because of revenue loss at this time, they also need to take some of the labor reduction measures as part of their overall cost-cutting measures. But they don't bear the full cost of this. The government comes in to subsidize part of this to workers. But we also need to make sure that workers are sufficiently protected at this stage so that they have something they can continue to pay for basic needs, continue to meet financial obligations at this stage. So I think I won't go into the details too much. I think we can have more discussion around it, but just to sort of motivate the discussion, I will just end here.
Okay, thanks so much. Thank you, Chris, for doing a really good introduction on your point of view. I'd like to share a screen actually. Let me just put that up at the moment. Okay. So I hope everyone can see this. I just wanted your quick feedback on this. So this chart basically shows you the announced fiscal stimulus in each of the countries displayed as a percentage of GDP. These are all stimulus that have been announced ever since COVID-19 started. And you can see that the first stimulus that was announced by Malaysia was 1.2% of GDP, which is very small. And of course, Singapore's has since gone up to about 11% based on its announcement yesterday. So we expect that there's going to be a stimulus announced today by the Prime Minister. What do you think the percentage should be? I mean, looking at what France, the UK, Germany, US, and so on have already announced. And do you expect that it's going to be anywhere near as large as, say, France and the UK?
So I think on the fiscal stimulus, I mean, looking at what other countries have done, I mean, it's already a clear indication that we need a larger fiscal stimulus compared to what we have right now. I mean, the number that has been thrown around in terms of the economic package now is about 160 B. But we have to recognize that about 103 billion is actually coming from monetary policy. Another 50 over billion is coming from EPF, and only about 4 billion is coming from our fiscal stimulus. So I think definitely we need to increase this significantly. I'm not sure if I can put a number to this right now, but just looking at what other countries have done. But I've highlighted also that I think that there is some kind of a fiscal challenge right now because of a fiscal rule that the country has, which may actually block us from significantly increasing the amount. Because if you look at what we call the current balance, I think in 2018, it is slightly below 2.5 billion. So that means we actually have very limited fiscal space right now, unless they can find other ways of actually raising the funds. So on the one hand, I'm really hoping that they would increase the amount, but on the other hand, I'm just wondering how they're going to do that given some of these structural challenges that the government is facing.
Yeah, indeed. I think the government is going through a difficult time. I mean, already we know that the previous government was having problems in meeting its fiscal targets. So it's really going to come into a difficulty in the next quarter. Okay, so I think we can come back to you, and I think once we've heard views from all the different panelists, I'm going to probably address questions to each of you, and then of course we're going to open it up to the participants later as well. But let's just jump to your colleague, actually also from KRI, Rachel Gong. Now, Rachel is a senior research associate at the Khazanah Research Institute as well. She is researching digital tech, so digital technologies in society, collective behavior and social movements, urban policy. Now, there's much discussion now about the potential to use digital surveillance as a tool in the fight against the virus. And from what I understand, while some countries have been using digital tech for contact tracing, that's not something that Malaysia is currently doing. But I'm not the expert on this, and perhaps I could go over to Rachel now. Rachel, can you share your thoughts about how digital tech can assist us in the ongoing crisis?
Sure. Hi, just again, very quickly wanted to echo Chris's thanks to IDEAS for organizing this and inviting us to be part of the panel. Yeah, so in thinking a little bit about what technology, digital tech in particular, and the internet can do in a situation like this, I think we're all seeing how dependent we are on solid internet infrastructure in the country. There have been some initial reports that when the MCO first started, the data traffic from Malaysia obviously went up a bit, but the performance was mostly consistent. And we are now actually, as we get further into the MCO, seeing it take a little bit more of a hit. So kudos to the telcos and backbone infrastructure people who are still working on that. But in terms of thinking about how we can actually apply the tech to being able to address the pandemic, digital surveillance and contact tracing is one option. And we don't quite have the system set up in the way that China and South Korea have set it up, such that it can be managed at a government level. Right now, I think the most practical option is perhaps for MOH officers, when they're doing their contact tracing interviews, to request permission from patients and POIs to have access to their phone GPS to be able to trace more accurately in case, for example, people might have forgotten where they were in the last 7 days, or exactly what areas they might have wandered into and who they might have come into contact with. And when you overlay that sort of data, again with consent from the user, over some of the maps that the MOH already has on where hot zones are, I think it could be used potentially to sort of estimate where we're going to see increased number of cases and to predict where the spread might be going. But of course, this is going to require perhaps a little bit more effort and technical ability than we have right now in the midst of the crisis. The other thing that I actually think the government could perhaps do to improve communications, especially because we know there is a misinformation problem with a lot of, here are ways you can avoid infection, here are ways you can reuse your mask, drink water every 15 minutes, that sort of thing. If the government were a little bit more open and transparent with its lines of communication, for example, if they were to continue texting alerts, right now I believe a lot of people are receiving SMS text alerts from the National Security Council. But I think if MOH were to get into this as well and perhaps be able to text people updates on the state of the spread of the disease, what areas might be potential areas that people would want to be careful of, even if they're going out to do their essential tasks and all that, that might be helpful. And making sure that there is a channel of communication for people who might not have access to social media, who might not be intentionally turning on the news to try and be informed. At least the government then is coming in and being proactive about that. And then I think, of course, the other way that telcos can get involved is to really improve and enhance the data initiatives that they've already suggested. a number of them are offering a lot of improved services, free data, and so on. But where I would be a little bit, dare I say, critical of that is I noticed that a lot of the plans are targeted towards postpaid customers. And the reality, I think, is that postpaid customers are the people who may have already a large bucket of data, may have fixed broadband at homes, and aren't in need of additional data. Whereas you have, I think, daily wage workers, people looking for gig work, people who aren't working from home, who have been told that they can't come into work and can't make an income, who might need extra data to try and see what other sources of revenue they can try and find and try and generate. And it's really these people that we should be targeting the free data initiatives at. So those are just a few of the thoughts that I have. I'm happy to elaborate a little bit more on those or talk about community initiatives, but I think upfront that's just what I wanted to say.
Thanks, Rachel. I think you talked about the need to have transmissions from the Ministry of Health as well. I believe that the MOH and the National Security Council both have Telegram messaging services, but the unfortunate thing is I think perhaps not everyone is familiar with Telegram, and of course direct SMS would be much more effective. But I just had one quick question for you, which is that, okay, say, I don't know, whatever the time span is that people are expecting this to abate, say 18 months or so, what do you think will take place in all of our societies when the tech surveillance has already, been heightened up, pushed up to the maximum? Will it not be difficult for both governments and people to roll back some of these surveillance, and what does that do for, data security?
Yeah, that's a really, really good question. And that's something that I think a lot of countries are struggling with, and why a lot of the more privacy-oriented countries, particularly in the West, are reluctant to enable digital surveillance. They're worried that, essentially they're worried about mission creep, right? That something that you start right now could later on be used for more insidious purposes. And, there's a great privacy advocate in the United States, the Electronic Frontier Foundation, that tries to tackle this issue. And they say that, you have got to consider and regulate very carefully what are steps you take in an emergency, in a crisis, that do not get to be translated into an ongoing system. So it's very much, let's set up this ad hoc system that we can turn off and enable regulations that require this thing to be turned off in a non-emergency scenario, and then should, we unfortunately be placed into another crisis, turn that back on as and when needed. But admittedly, this is not something that there's a good example for. I think it's something that everybody is still working on and still thinking about. And I think Malaysians are very privacy oriented and conscious about that, and very careful about who they give their data to. But I think, as even with thinking about spending and things like that, we're in a situation now where we may have to give up some of those freedoms for the public good.
Thank you, Rachel. Let's move on now to our next speaker. So we have with us Carmelo Ferlito, Dr. Carmelo Ferlito, who's an IDEAS Fellow. He is the Director of the Center of Market Education. And he, interestingly, I think, and also most importantly for our discussion today, is a manager of an SME in the food industry here in Malaysia. So Carmelo has on the ground experience of what businesses are going through as a result of the MCO. So I think in addition to his perspective as an academic economist, his views on how the government can help businesses to carry on will be really very interesting. But before I go to Carmelo, I also want to just share some charts, which one or two that will, I think, be very useful for the audience. So sorry, I apologize in advance that I didn't even have a time to show our panelists these graphs that I'm asking them to comment on. But let me just show you this one, which I hope everyone can see on the screen. It basically shows the proportion of Malaysia's food supply in 2017. The one in orange is imported food, in blue is locally produced, so production, and then in gray is what we export. So Carmelo, maybe you have a better sense of how to comment on this. And I think the main question on everyone's minds is, okay, well, food supply is one thing, but maybe first talk about business community and SMEs, and then later we can talk about the supply chain of food, which you have direct experience in. Okay, over to you, Kamal.
Thank you, Tricia, and thanks for having me. Well, the situation is complicated, and I don't want to give the impression that some of my considerations might look like emotionless, but instead, in this scenario, my perspective is full of emotions. I look, of course, at Italy with concern. My family is living in the red area, and in Italy, due to the present traveling difficulties, if something would happen to my family, I would even be unable to be in Italy in this moment. So, I mean, I'm emotionally involved with the current scenario, and the example of Italy that many countries are taking is unfortunately showing that probably a prolonged blackout of the movements of the people is not enough or not the best measure in order to solve the problem. Italy has been under a lockdown for 3 weeks, and yesterday we had 4,500 cases and 700 people dying of COVID only yesterday. So I'm afraid that the direction that the government is taking in Malaysia, where instead the mortality rate is much lower because we are close to 1% against the 10% of Italy, is risking, with the disruption in the supply chain, to create more problems coming from the economic difficulties than the ones that are actually produced by the virus itself. So we should look at the trade-offs implied in this. And what probably now the policymakers are not realizing is that the supply chain is so much vertically and horizontally integrated that even to distinguish between essential services or essential products and non-essential ones is utopistic, I would say. And I mentioned to you already this example. If we look at chicken farms that I know very well because of my job, we all can assume that chicken production is essential in Malaysia. Malaysians are the third world consumer of chicken per capita in the world, 46 kilo per person per year. But in order to produce chicken, you need machines nowadays. So farms are not that romantic as they were used to be in the past. So you use motors, you need air conditioning, you need screws that are produced maybe in a small village in China. You need ventilators that are produced maybe in Taiwan, or piece of papers for the cooling that are produced again maybe in China or in Italy or in Thailand. So how in the realm of, in example, livestock production, how do you really distinguish between what is essential and what is not essential? So if chicken is essential, we should, to judge as essential whatever is necessary to produce chicken. And then you go to Siemens that produce motors for chicken farms, an example for the feeding lines. And how can you tell to Siemens you have to produce only those motors that are actually used in chicken farms, and you can't produce motors that goes in other industries? So we risk to spend more time in brainstorming about essential and non-essential products and services than actually being involved in solving the problems. So I would tackle this problem from a different perspective. So because in this moment, I believe we are risking to remain without food supply on the shelf of the supermarkets. This is what we are risking. And I would say, let's restart a gradually the economic activity, but rather than spending money with a lot of subsidies here and there that have, of course, a very limited impact in time and cannot be prolonged forever, let's spend this money in implementing massive testing on the workplaces involving the private sector, the health private sector, asking support from faculties of medicines, so from the university, and follow a more Korean style approach to the problem. So you are sure that the people that are going to work, and we can imagine a gradual stepping back to work, are not infected. I did that for my staff. Before the lockdown, I got all my staff tested to be sure that people are safe. And I was happy to pay for my staff to get tested. So we need, as was mentioned, temporary support to employment and maybe something more from the fiscal side. But I think that we'll achieve greater results with a massive strategy of testing that will allow the production possibilities in Malaysia to gradually restart. Because let's not forget that most of the economic structure of Malaysia is made of small and medium enterprises. The company where I work is a branch of a multinational company. We can stand for long, but 90% of the economic structure in Malaysia is made of SMEs. How long can they stand without operating, and how long the government can support them of being non-operational? So these are the questions that we should ask, and probably we should lead us toward another approach. And last consideration, think that we are going to end the MOC on 14th of April. But what is going to happen on the 23rd of April when the fasting month will start? And we will have all the gatherings that happen with the Buka Puasa, so the breakfasting every evening. Which kind of approach are we going to take on this, which involves so gathering of people, massive supply of food? What are we going to do with this? So with the fasting month approaching, we risk to have to prolong the lockdown until the end of May if we don't opt for a different approach.
Carmelo, thank you for your initial thoughts. What you shared about the interconnectedness, both vertically and horizontally, of the food supply chain, I think is of real interest to all of us. I mean, ultimately, we are the consumers of food, and I think that really needs to be the priority of the government for now. I'm just wanting to pull up another chart again that shows you on the screen just how integrated our supply chain really is. And this is from an article that one of our colleagues at IDEAS wrote, Lawrence. So I think it basically echoes what you are saying, that if you look from agriculture, processing, I mean, there's small elements within the supply chain that perhaps the government isn't thinking of. And we know from anecdotal evidence already that some of these companies are having problems in getting their produce out. There was a news article about how Cameron Highlands had to dump, some of the farmers in Cameron had to dump a whole supply of vegetables and fruit, which are obviously things that people in the Klang Valley would have benefited from. But so what I'm just trying to understand now. So what is the solution that you are recommending for the government to do? If you're saying that it's not possible to separate between what's essential and non-essential, are you saying then that everything in the food supply chain needs to be fully operational at the moment? And how do we then mitigate the possible negative impacts of further spread of the virus?
Well, what I would say, what I would propose is a step-by-step reintegration of activities only after a big effort on massive testing. So being sure that the people that are going to work together within the same physical space are not infected. And this is one point. The second point is reintroducing immediately logistics among the essential services. The news of this morning was that the MOT, the Minister of Transport, asked to start to move out non-essential goods from the port, because Port Klang and Port Penang are collapsing because goods are not allowed to go out. And if the non-essential goods don't go out, even the essential ones cannot go out, because ports have limited capacity. And you have shown the massive import of food that we have. To come back to the example of chicken, 65% of cost of production of chicken comes from feed, and Malaysia doesn't produce feed for chicken. Is almost 100% imported from India and from US. So you need to allow these things to come in. So logistics need to be restored 100% and as a huge priority. Then effort on massive testing and gradual come back to, at least to the manufacturing sector, to those functions that cannot be performed from home. There are a lot of jobs that still can go ahead from home, but manufacturing, at least at a reduced scale, but this can be learned only from experience, need to be restored.
Okay, thank you very much, Carmelo. I mean, obviously, I think even from amongst the panelists already, we can see the constraints that government is operating under, while on the one hand, what Chris has mentioned about the need to expand social protection, but on the other hand, we have also the need to continue economic production. And we know that the government is also struggling with its existing fiscal targets. So how do we actually come up with a plan that works, and not just for the short term, but for the long term? We will have a bit more active discussion later, but now I'd like to turn to our final speaker. But before that, I'd also like to do some housekeeping, which is that the participants, and I'm glad more of you have joined us. Thank you for joining us. You can actually already start asking questions. So there's a Q&A box somewhere that you can click on. And I see that Rachel has already been very good at multitasking and answering one question. Please start to put up your questions there so that, you know, I as the moderator can start to read through them, and I'll try and filter some of these through. Perhaps not everything might be answered, but I'm going to try as much as possible to answer as many of them. So start to think of your questions and put them up. And now we are going to a more regional perspective. Dr. Jayant Menon is joining us from Singapore. He was formerly from the Asia Development Bank. He's now a visiting fellow at the Institute of Southeast Asian Studies, Yusof Ishak Institute at NUS Singapore, and he's also a fellow at IDEAS. Now, Jayant is an experienced trade economist, and I believe that while we're talking a lot about the domestic economy, I think the trade dimension has not been given enough attention in Malaysia, especially given our dependence on imports in key areas such as food, which is evidenced from the chart that I showed you earlier. So I'd really be keen to hear more from Jayant. I have a question for you based on your piece that you wrote, but I think we'll leave that for later and let you elucidate your thoughts first with us this morning. So Jayant, over to you.
Thank you very much, Tricia. And let me also start by thanking IDEAS for having me. I guess as the last speaker, a lot of the things that need to be said have already been said, which is a good thing. I've enjoyed listening to everyone. But let me see if I can say a few more things to add to the discussion. So I think the first point to make is that the coronavirus or COVID-19 outbreak is first and foremost a human tragedy. Carmelo just mentioned this as well. And I think we have to repeat that, especially economists and financial analysts. Sometimes we can appear as if we forget that this is really a human tragedy more than anything else. But having made that qualification, I will focus mostly on the likely economic impacts in the next 5 or so minutes that I have. So actually the economic impacts are mostly driven by the measures that we are introducing to deal with the medical problem, right, of virus contagion. But the economic impacts also have their own contagion that can spread the problem going forward. Now, many have already tried to put numbers to this issue in terms of impact on economic growth, you know, country by country, region and global. I'm not going to go through all of them here, except to say that the estimates vary greatly. Some are relatively minor, some are quite apocalyptic. As Chris mentioned earlier, one thing is clear is that almost all of them suggest that it's going to be worse than the global financial crisis that we had in 2008. So rolling recessions are expected around the world. Even the IMF has come out warning that a world recession this year is almost inevitable, but they also say that a recovery could be quite rapid, happening in 2021. So not just the R word, recession, but the dreaded D word, depression, is starting to be used with depressing regularity. So the news is not good. Now, let me focus, however, on what the main transmission mechanisms are likely to be, and then say a little bit about what we need to consider in assessing the assessments to make sure that we get good information from what is out there. And finally, say a little bit about what we can expect in Malaysia itself. Okay, so I think there's a few channels, some of which we've already discussed, and each one has its own time dimension. In the early phase, we've already seen this, tourism and business travel and all the industries that they are linked to are very quickly affected. But the main impact that we can see in terms of the spread of the economic contagion is through supply chains. And this is where China's central role becomes critical. It's a hub for regional supply chains, but it's also a global player. More than 12% of trade in parts and components globally is controlled by China. So as we've heard Carmelo mention and describe quite vividly, supply chains are fantastic things. They produce great benefits in efficiency, but they're also very fragile, right? A break in any part of the value chain can lead to its collapse. So this is the nature of production that we are faced with, and a crisis like the current pandemic highlights the fragility of the system very vividly. The virus is also affecting labor supply because of the lockdowns and the MCOs and so on. And the impact of this, however, will depend on how long they're in place and also will vary by sector. So manufacturing will be particularly hard hit. But some service industries, especially those that don't require physical presence, you know, the drop in productivity can be reduced significantly with technological aids, telecommuting, and even this current Zoom exercise that we are involved in with the webinar is a great illustration of how life can go on in some sectors. But all of these things will result in quite sharp declines in domestic demand, And the thing to remember here is that there's a compounding effect that will take place. The drop in demand will feed on each other, and this will magnify the impact and extend short-run effects into the long run. But perhaps the highest cost will come from the so-called intangibles. This is the stuff that we can't measure directly, but is very real. These are the effects on sentiment, the negative impact on sentiment, and also the general uncertainty. This will affect financial markets, and we're seeing this already, but it will feed into the real sector. And that's what we need to be concerned about. Lower investment, consumption, and eventually growth going forward. Right, so those are basically the general mechanisms that operate. Let me now relate them very quickly to what I think, how I think they might impact Malaysia. As we all know, and as we've heard again already today, Malaysia is a small, open economy, heavily dependent on trade. It's particularly dependent on trade with China, its major partner. And partly because of this, it is very heavily engaged in regional supply chains. So it'll be particularly badly affected by any reduction, by the reduction in final demands for the goods that are produced within these supply chains. Because the final markets, right, for these goods are usually outside the region, and demand in all parts of the world is falling sharply. But over time, there will be supply side adjustments taking place that will alter both trade and investment patterns. The main adjustment will involve relocating certain activities out of China mainly and into countries in the ASEAN region. And Malaysia could be a beneficiary of this new investments coming in. And this will offset some of the overall negative impacts that we are observing. Malaysia is also an oil exporter, and the government relies heavily on oil revenues to fund its spending. Now, the price war that has occurred indirectly as a result of this pandemic and the huge price drops will hit it hard and put further strain on the growing fiscal deficit with the stimulus packages being considered. Now, let me finish on two cautionary notes. I think in identifying both the short-run and long-run impacts, we have to try and separate the marginal impact of the COVID virus from observed incomes. This is important because our response or remedy will vary depending on the real cause of what we see or the real cause of the disruption, right? We have to remember that the COVID-19 pandemic and its impacts have come on top of a number of other factors that have already been affecting the region and beyond. Even before this outbreak, risks of a global growth slowdown were rising, driven by a number of factors, not least of which was the US-China trade war, right? Now, the US-China trade war already started causing a lot of disruption and relocation in the supply chain, right? Now, the COVID-19 crisis will hasten the pace and extent of that restructuring, but it's only partly responsible for what is happening and what will happen. So it'll be misleading to attribute all of the observed disruption to COVID-19 alone. This is easy to do, and we should be careful not to do it, right? In fact, had the trade war not happened, or had the trade war not preceded it, COVID-19 will probably have resulted in even greater disruption to supply chains. Some of this disruption isn't happening because it already happened because of the trade war, right? So we need to bear that in mind. And finally, we have to reassert the obvious, and that is that the growth and spread of the virus is evolving in unpredictable ways. We still don't know what will happen almost day to day. And the difficulties of estimating the impacts of a shock that itself uncertain is self-evident, right? So we need to consider various scenarios in our assessment. Currently, the trend points to rising risks, often accelerating risks, although this can itself change very suddenly, as we have seen with previous epidemics like SARS and MERS. But all of this uncertainty cautions us and reminds us that we have to be very careful in assessing the assessments, and also how important it is to keep recalibrating our tools, our models, to ensure that we keep up to date with our assessment of the shocks, because the shock itself is evolving. So let me stop there, Tricia, and back to you.
Thank you very much, Jayant, for giving us a bigger picture of the trade situation. And also, I think the last point that you made about cautioning us not to overanalyze the impacts of the economic fallout solely on the COVID-19, but also being aware that there were other structural failures already. But I do want to bring up something that you wrote in one of your articles recently, where you actually believe that the movement restrictions in Malaysia had gone too far too quickly. And I think you alluded to that point where you said that there are perhaps only marginal effects of imposing such strict MCO requirements, given the potential drawbacks within the economy. And I believe you also used the term that if Malaysia had not yet seen a rapid community transmission, then it could possibly mean a greater negative blowback in the economy. But yesterday we saw the largest increase of 235 cases in Malaysia alone, and I think we haven't actually seen the full brunt of the transmission within the community yet. Just wondering about your thoughts on that, because I think that there are also studies out there, and I promise this is the last thing that I'm going to show on the screen, which is essentially a graph that was taken from a paper by the Imperial College, which I think is a paper that many governments around the world are using to base their own restriction movement orders on. And this graph basically says that if you do nothing at all, then you have a very high spike of cases at the very start. And if you do the green one, which is what we're doing right now, it prolongs that curve a lot greater. And I think everyone already knows we are talking about this flattening of the curve. So what do you think could have been done better? I mean, seeing the economic impact of what's already happening in Malaysia and beyond.
Right. Okay. So thank you for that question. I think that is a very important question, and it's something that we must keep asking. Are we responding in a way that ensures that the benefits outweigh the costs, right? And of course, this is not an easy question to answer in any country, but particularly difficult in countries where data is limited. Right? Data from testing is still low in Malaysia, even lower in the Philippines, and low in many poor countries because, for obvious reasons, the resources are limited and they don't have the test kits. And if you're very poor and you can't afford healthcare, why would you care about being tested anyway? So I don't think we should do nothing. And I don't think any country is doing nothing, but should we do everything or go the nuclear option, basically, of shutdown when we don't have an overwhelming set of suspicions, at least, that there is rapid community spread, right? Countries that have gone the complete shutdown, like Italy and Wuhan in China, should have done so, have done so, and are seeing results. Even Italy now is finally beginning to see results. In Malaysia, rates have been rising sharply, but there's nowhere near what we would consider rapid community transmission, right? Of course, rates are going to rise when you test more, but how long can you shut down for, right? Shutdowns are by nature unsustainable, right? So have we overreacted too early without enough information is the question I'm asking, not my assessment. And I think this is a question we need to ask more often and encourage more debate to ensure that we don't just assume that you can't do too much of a good thing, right? There are costs of erring on the side of caution, and those costs sometimes can outweigh the benefits. And that was the point that I was trying to make. We need to be a bit more open in questioning the measures and not assuming that more is always better. There's no gold standard here, and we don't have to emulate the West, right? We have to look at local conditions, adjust for local realities, right? And take into account that these sorts of measures have a disproportionate burden on the most vulnerable in our society, and they can suffer irreversible harm and greater harm than the impact from the virus itself. I hate to agree with things that Trump says and don't do so very often, but I think when he says the cure could be worse than the ailment, I don't think that's necessarily true in rich countries like the US, but certainly this might be true in poor countries where there's tremendous pressure on healthcare systems and where safety nets are almost absent. Yeah, let me stop there.
Thank you. I think that's a very sobering view indeed, and one that I don't think has really been given much attention locally. It's probably also considered a controversial question to ask, given that the priority is, evidently to also allay, I think, the very real public fears of the spread of the virus. Okay, I think I'll do a bit of a stock take at the moment. It is 11:56 on my computer, and we can run all the way to 12:30. I hope that we don't lose the attention of our attendees, but bear in mind that this whole thing is going to be available for viewing later because it's currently being recorded. So I think we have about half an hour now for questions and answers. I see quite a healthy number of questions already. I think if you have any opportunity to, if some of the panelists would like to address the answers, by typing the answers out, that's also an option available to you so that we can get through most of the questions and in a bit more of an efficient manner. But I think I would like to now go back to Chris. So thanks, Chris, for waiting. You were the first speaker and you've had to wait through almost half an hour now for the rest of them to finish. There's a couple of questions here that are addressed to you, and I'll start with the first one. Basically, the question of balancing out how much the government should spend. I mean, I think that's the umbrella question here that people are interested in. So some of the related questions to how much government should spend are, number one, how much should government use of its reserves? I mean, should government be using its reserves at all? Should we tap into our reserves? What are the current guidelines with regards to using the reserve? The second related question is, I think someone's asked specifically on whether 160 billion is going to be enough. I think you did sort of say that at the beginning that you're not sure the precise numbers. And I think a third thing that's addressed to you, well, a fourth actually. So the third thing is how much protection is necessary I've seen some groups calling already for a 1,000 ringgit, direct cash handout into the pockets of people, whether it's B40 or, even up to the M40. I think the classification is not very good, actually. And finally, Hok An has asked directly to you as well, whether you have any insight on how the government has computed the EPF account to withdrawals. Is there an explanation to these 7 million active accounts taking out a maximum of 6,000? So does it compute? So Chris, if you can talk about some of these social protection measures, that would be great.
Yeah, thanks, Tricia, and thank you for the questions. I think I will answer them in three ways. One, look at the macro fiscal injections that are required, and second, I want to focus more on the costing for the employment retention program, and I'll answer some of the more specific questions on the calculations for the EPF. So I think on the macro level, as I said, it's not easy to put a number to it, but just to, I think for comparative purposes, if you look at Denmark, for example, the total fiscal package that is put in place is about 13% of their national income. Singapore just announced their package yesterday, which comes to about, I think, $48 billion, which is about 11% of their GDP. When Malaysia had the 2008-2009 global financial crisis, it was at about 60 billion, I think, which constitute about 9% of our GDP at that time. So at the moment, as I said, our fiscal policy, the fiscal injection is only about 4-point-something billion. Why are we even talking about tapping into the reserves yet when our fiscal space has not been fully optimized? So I want to emphasize that at the moment, what is lagging is not on the monetary policy side. It's not about tapping on the reserves or even about tapping into EPF or social contributions, but it's about increasing the fiscal injection. And I think, which is why, because the fiscal injection is not increased, so there's all this pressure now to continue to dip deeper into our social protection funds. And we just saw yesterday, the Malaysian Employers Federation has now come up with proposals, not even to, not just EPF now, but they're looking at SOCSO to ask for exemptions in terms of contributions to SOCSO. And this is actually a social insurance scheme where they run on, they need cash flow as well to pay out for different types of employment-related risks like employment injuries, sickness, invalidity, and so on. So I think there's a lot of concerns there if this evening, if we listen to the announcement and the fiscal policy, the fiscal package is not adequate. So that's my first response on the overall package. But I think specifically, if you look at employment retention program itself, currently the amount that is allocated under the first round stimulus is actually about 120 million ringgit, as I said, targeted at 33,000 workers. So the assumption of the impact of employment, of COVID on unemployment is actually very, very low. So, but we are looking at estimates that are coming out from different think tanks, like MER has predicted that it's going to go up to 2.4 million workers that will be affected. SME Association of Malaysia is talking about 1 million workers. And I think my own sort of ballpark calculation, if I look at 30% of private sector employment that will be affected, combined with what I call self-employed workers, we are looking at about 3 million workers. So is 120 million even sufficient to begin with? So I have been calling for a scale up of this employment retention program on three fronts. One is that we need to scale up in terms of covering all forms of work. And this is not just about formal employment, but this is also about self-employed workers. And actually we have the mechanism currently through SOCSO. I mean, there's something called a self-employment social security scheme, which we can tap on in terms of how we want to channel some of these assistance to the self-employed workers. And Carmelo has spoken about the supply chain. I mean, the supply chain, if you look at it, I think self-employed workers play a crucial part in this supply chain as well. And a disruption to them as well, I think will also disrupt the entire supply chain. So I think first is coverage of all forms of work. And second, I think we have to look at coverage of all forms of labor reduction, because at the moment, the program only looks at coverage of forced unpaid leave. But I think a lot of firms are actually thinking about wage reduction instead, given the kind of relationship that the employer and employee has. So I think this form of labor reduction currently is not covered by the program. And third, of course, the payout amount is 600 ringgit for a duration of 6 months, which I think to me is definitely on the low side. The benchmark should definitely be the minimum wage. So if I do a very ballpark calculation, if I take about 3 million workers, even if I use the assumption of 1,000 ringgit per month over a period of 6 months, we are talking about 18 billion ringgit that needs to be put aside only for the employment retention program. And again, to give you a sense of the scale, if you look at Singapore, for example, they announced about 15.1 billion yesterday under what they call the Job Support Scheme, which is their version of the Employment Retention Program, which is huge. UK has earlier announced something similar, and they said they will put unlimited funding to this. And for these two countries, they also include self-employment as part of the assistance package that they put in place to support workers. So I think it is very comprehensive, and I hope that we will really catch up in terms of how we think about this. And lastly, I think on the question by Ho An, on the calculations of the EPF withdrawal for 40 billion, but actually they specifically mentioned that the target is not 7 million employees who will benefit, but it's 12 million employees. That means they would have included also non-active contributors in the EPF. And I think their assumption is about 50% of take-up rate of this 12 million, which I think will give you something like a 40 billion kind of package. But I think our own calculation, just looking at EPF's annual report itself, the assumption that if you can withdraw 6,000 ringgit for the next 12 months, that means you need to have a gross savings of about 20,000 in your account 1, then you have 30% that goes into your account 2. It shows that actually almost 40% of our active contributors in the system will not be able to benefit fully from this ISEAS-Yusof program that was introduced. So yeah, that's.
Chris, just one more question for you from Lawrence here. So if you're talking about expanding coverage for social protection, so basically informal or self-employed, and I think you mentioned the gig economy or someone else did. We know, for example, that the informal economy is quite significant in Malaysia. I mean, you're talking about your mom and pop shops, your sellers of nasi lemak, curry puffs on the roadside and so on. Do you think that the government will be actually able to register and enroll them in time? I mean, you're talking about implementation in the next 10 days. By the time some of these measures are rolled out, do you think that, would the MCO have ended by then, perhaps?
No, I think definitely we have the mechanism, because if you look at what I call the SES, the Social Employment, Self-Employment Social Security Scheme that is under SOCSO, at first they opened for registration only to the passenger transport sector, but now they've expanded it to 19 other sectors. But at the moment, the registration, like you pointed out, is actually very low. It's only about 50,000 self-employed workers who have registered with the system. But in terms of our estimation, we are looking at about 3 million plus self-employed workers, which I think could be in both the formal and the informal sector. But we see this actually as an opportunity to actually increase the registration at this point, because it's a voluntary scheme. So a lot of previously there's no impetus for self-employed workers to want to register. But this is actually one big opportunity for us to encourage more people to register with the system, and then to sort of find a mechanism to channel the payout. Now, I must say the limitation of this is that because the scheme currently only focuses on employment injury, so it doesn't focus on unemployment issues. But there are ways around it in the sense that we can use this registry as a way of targeting and identifying the self-employed, but we can use the EIS mechanism, like how they've extended it for the ERP, to channel the social assistance to the self-employed workers. So I think the mechanism is there, and I think if we act fast enough, I think it should be okay.
Chris, sorry, one more question, which I'm not sure whether you addressed, which is that, so here you are calling for like greater fiscal stimulus or even protection of the economy. I mean, how does that actually work when you look at what will happen in the long term, and also seeing that oil prices are falling, and we know that our economy is quite dependent on oil? Should we be tapping on reserves? I mean, how does the government then create a sort of balanced scenario, while at the same time, I think there was this article by Dr. Nongsari and Hamdan and a few others talking about how they were surprised that the government is actually aiming for balanced budget during this time. What should the goal here be?
I think we should definitely drop the fiscal deficit target at the moment, because if we are still concerned about that and about credit ratings, I think it's really misguided. At this point, even if it's doubling of the fiscal deficit, I think that's okay. But I think we need to think in terms of phase. I mean, like now it's about a containment phase. It's about putting in place protection, because you cannot use conventional policy tools. But then we have to also look in the medium term. That means once the the crisis is over, when people can resume economic life, then we can kick in the more conventional policy tools. And if the fiscal space, if by then is insufficient, I think then we can look at other ways of raising funds, whether this is through tapping the reserves and whatnot. But for me at the moment, because the 100 billion that has been announced by Bank Negara is actually quite substantive, but because the 100 billion actually is I think the more direct support will be given to SMEs in terms of loans and all that, as opposed to households and workers. So I think for households and workers, the mechanism and the infrastructure has to come more from the fiscal space side. So I would think that we need to think about this in phase. If we think that the impact is about 1 to 2 years, how do we then put in place the tools and the amount that is needed for this 1 to 2 years? And the challenge right now is actually there's no message from the center, whether it's from the NSC or the ESC, as to their assumption of how long and how severe the pandemic is going to be. Of course, I think nobody can be certain at this stage, but we need a shared assumption here, because otherwise every agency is using their own assumptions to design programs. So maybe SOCSO is coming up with another protection for 6 months. This ministry is coming up with protection for 1 year. And that's not the way to go about it. We need a more coordinated response, and this required shared assumptions of how severe, and I think this assumption also needs to be out in the public for people to challenge and to debate. Yeah.
Okay, thank you. Carmelo, I wanted to ask you, and thanks, you've been really good in answering a lot of the questions already by typing out the answers, but I do want to still get your thoughts about the food issue, because I think, yeah, that's an important thing to address. So one of the questions from our attendees is, what would be the best or fastest solution to act now to quickly meet the current over demands of food and medical supplies? So I mean, this thing about over demands of food as well, I mean, I know that people have gone into several rounds, not just one round of panic buying, and I believe that some households are probably perhaps over hoarding, and primarily based on the very real fears as well that we're going to come into economic recession or even depression, as Dr. Jayant Menon mentioned earlier. So what needs to be done now to meet this over demand, you know, bearing in mind that the supply chains are also being affected as we speak? Wait, okay. Carmelo, I need to unmute you, or you need to unmute yourself.
Yeah,
okay,
sorry.
Speak now.
One preliminary consideration that I was doing, because I also thought about this over hoarding or people rushing to supermarket. Of course, hoarding, emergency hoarding is surely part of what is going on, but I would like to add one consideration, because we are, I think that this increase in the demand for food is not simply due to hoarding attitude, but also in a forced change of consumer preferences. Malaysia, and in general Southeast Asian countries, compare with a country like Italy, an example, so Malaysians are more used to eat outside on a regular basis. This is because of several reasons, including cheap food available. So in Italy, we don't go out for eating so often like it happens in here. So all of a sudden, we have a massive amount of people that find themselves being forced to cook at home when they were not used to do so. So they need to buy groceries, and they were not used to do so. So this is something also, so we are facing a change in the structure of the consumer preferences, which was forced from outside. So this is something we have to keep in mind when we point the finger against hoarding. I think that is not simply hoarding. It's something a little bit more complex than that. Having said this, I think that my initial remarks remain, which is be very careful, because in order to produce food, you need a lot of things that you don't have in mind. Now, in example, some of the poultry farmers are reacting to this by increasing capacity. And what is happening? That in order to increase capacity, they need more equipment. And these equipment are being stuck in the port because they are machineries. So the supply side can't meet the stimuli coming from the demand side. So again, I think we need to ensure that the economic lockdown is as minimal as possible, only whenever is really harming people. And I would do so by implementing more, by spending more money in medical testing rather than in subsidies in this moment. This is the only way to get the supply side to react to the demand side fast. Limit the time frame of price rising. Prices are indeed rising in the supermarkets. I think we all have seen this. My coffee capsules has increased 5%. Alcohol has doubled the price, I think, or tripled the price. So if we want these prices to go back downwardly, we need the supply to come in to rebalance the stimuli coming from the demand. And the only way we have to do so is to keep production ongoing. And to keep production ongoing safely, we just need to test the people and to implement targeted isolation like Korea did.
Carmelo, there's something addressed directly to you, but this is actually more with regards to the health side of things. So maybe we can take a slight segue into the health side of things, because there's a few questions on that as well, and evidently there's interest. So the question directed to you is that you've suggested to have gradual restart of economic activities after rapid testing. But in the first place, do you think Malaysia has the capacity to do the rapid testing needed to restart the economy, because we're only doing 5,000 testing per day?
Well, of course, this is not my field of expertise. So the government said that by next week, they should be able to implement 17,000 tests per day, if I'm not mistaken. And this would be a very good increase in the shooting capacity, and I think is a very good number, because if I'm not mistaken, the main affected region in Italy did a total of 100,000 tests or something like that. So if the Malaysian government is really able to implement 17,000 tests a day, then I think we are in the right direction.
Thank you, Carmelo. I mean, since we're talking about the healthcare system at the moment, I just want to get into some of these questions that are related to that. Not directly related to economic impact, but I think still very much relevant. So I'd like to ask Jayant, actually. So there's a question here addressed to you about the public healthcare system and safety net measures. So the question is, I mean, you can read it as well on the site. The question is, can the government push for public-private partnerships to encourage sharing of medical resources? Some of the advanced equipment at private hospitals might not be utilized well enough to address the current COVID-19 issues currently. And I think for me personally, I also know that many of the smaller rural clinics, rural hospitals are also struggling with capacity at the moment. And perhaps while you're answering that as well, people always want good predictions of things. So I'm not sure whether you can predict this, but the question is, how bad is the situation going to be in Indonesia, other ASEAN countries, and also how do you see this developing in the next 30 days in terms of cases and also global market effects?
Okay, thank you for those questions that you've relayed, Tricia. So I think the first one on healthcare, others have spoken about this, and I think they're much more knowledgeable than me on this topic. But I think we should try any and every available option, right? Public-private partnerships, of course, I think can play a role. Although I think overwhelmingly this will be a public responsibility. Right, the public governments must take charge and try and ensure the provision of healthcare, health supplies, as well as ensure that the infrastructure that we need to provide those services is working. I think, again, we come back to this problem that Carmelo highlighted about, making exceptions in a highly interdependent and integrated system, right? It's very difficult to implement exceptions, efficiently. There are second best outcomes that are unavoidable, or unintended spillover effects. And so this is my general concern about, again, going to lockdown as the first response rather than the last, right? Rather than keeping your ammunition sort of dry for when the problem really is demonstrably out of hand. And I don't think we are seeing that yet. And I think this relates to the second question you mentioned about the impacts on Indonesia and other ASEAN countries. I think so far in this region, we haven't seen any country display signs or evidence of rampant community transmission, right? What does that mean? Well, Wuhan or Italy, or now increasingly in some other Western countries. But let's say Wuhan and Italy very clearly as rampant community transmission, right? So in the absence of that, putting it, there are many other ways to actually reduce risks, right? Without going to the shutdown, right? There are various social distancing measures that can be implemented without having to draw the economy into a grinding halt. And that's what I think some countries are still considering, but not doing. Like Thailand is slowly ramping up its measures, but they haven't gone full ball, and same in Indonesia. The problems here, of course, is that these are very big countries with, huge rural communities that are not easy to access. And so finding out what's going on in those communities is very difficult. So testing, while I fully agree, this is the key change in priority that we need now to increase the focus on testing as much as possible. There are challenges in developing countries in terms of ramping it up very quickly. But I hope and I believe that rampant community transmission is not yet present in this region, and the measures that are already in place should prevent it, hopefully. And in some cases, I think perhaps we need to review the very draconian measures to see if in fact they can be eased slightly soon, so that we don't actually overdo it before having clear evidence that we need to be so draconian in our response. Sorry, there's no clear-cut answers. I don't have a crystal ball, but that's as much, I think, as one can confidently say. Thank you.
Thank you, Jayant. I'd like to go quickly to Rachel now. So there is a question here about how the government can actually help companies to increase profits from digital and basically digital tech. I mean, I think many of us who are home now are very aware that many of the services have come in so handy to us, including things like Grab or even Lazada, Shopee, and so on. Can anything be done to help this part of the economy to flourish?
I think, yeah, that's a good question. And I think MDEC, the Malaysian Digital Economy Corporation, is working on some initiatives there. One thing that they are definitely emphasizing is trying to encourage people who were doing, those kind of service work, design, copywriting, all that sort of thing that can be moved online to register with their platform, so that then companies that are looking for, again, services that can be performed online to do that. They're also encouraging micro SMEs and SMEs to try to digitalize and be able to do e-commerce, especially where production is done in the home as opposed to, in a large scale factory, so that those things can continue to be marketed. Whether or not this is scalable, I think is a challenge that we will be facing together, because it's obviously something new for everyone involved, whether they have the necessary infrastructure and equipment set up at home in order to set up their platform. All those are questions that have yet to be answered. But I think it is, it's a good sign that there are agencies that are looking into this quite actively at the moment.
Thank you, Rachel. I'm just aware of the time as well, that we only have about 7 minutes left. So what I'm going to do is I'm going to ask a couple of general questions, based on what we have over here. And then I'm going to ask each of you to give your closing remarks between 1 to 2 minutes, and you can incorporate some of these answers in your closing remarks, or any additional thoughts or closing thoughts that you might have in this very important unfolding situation. So the questions that are general are basically, how can these good ideas be put forward for government consideration? I guess that's a question for ideas, actually. What is the sense actually from all of you that the government is ready to listen to these suggestions and to incorporate them, filter them, incorporate them into their decision-making process? Is the government currently open and actively engaged in this feedback process? Maybe I can, since you're Rachel on the screen at the moment, maybe you can end, and then we'll go kind of backwards. So Rachel, Jayant, Carmelo, and then Chris will have the final word, and you can also answer some of the questions addressed to you, Chris. So Rachel, to you.
Thanks, Tricia. I think, to be honest, I'm not really sure. I don't personally have close connections to various decision makers in government at the moment. Where I can say I am talking to people who are listening and are trying to feed input in as well, is definitely at MDET, where they're trying to get ideas on, what are these effective ways in which we can promote the e-economy and the digitalization of various SMEs. So that's helpful. I think the key here would be really opening lines of communication and reacting quickly. I think there's a tendency where we want to kind of play it safe and watch and wait. And I think rightly, there are situations in which we have to do the necessary research and make sure we have all the right data before we start on something. But circumstances are trying at the moment, and there are cases in which we might want to take a little bit of risk. Again, coming back to that, giving up personal freedoms thing, where we might have to shoulder a little bit of the burden together so that we can do these things. I think community initiatives, the Kita Jaga Kita thing that has sort of sprung up online is a good sign, again, that the community, that Malaysians are banding together and finding ways to tackle the crisis. So I'm going to end with that.
Thank you, Rachel. And Jayant, do you have any closing remarks? And you can feel free to answer any of the questions. I think there was one more addressed to you, which was what are the crucial steps needed to be taken to mitigate short-run impacts, but also the question earlier about how this can be actually forwarded for good recommendations.
Right. Okay. So in terms of short-term impacts, I think, the stimulus packages are the ones that we hope will kick in very quickly. And we've heard already how I think the panelists have some consensus in the need to shift from, further monetary loosening or monetary measures to direct fiscal measures. I fully agree with that. I think at this point, with already sharp falls in demand biting, we need, the equivalent of cash transfers, right, to those who are most in need, the most vulnerable, and also luckily, those are the same people who are likely to spend most of what they receive, right? Which is exactly what is required, right? You don't need people saving or hoarding. People are hoarding different sorts of things, but not, you shouldn't be hoarding income. This is a time when any increase in your income should be spent if you're looking at offsetting the drop in demand. And so the low income communities are the ones with the highest propensity to spend, and they're also the most needy right now. So I think governments should target them, and as directly as possible, conditional cash transfers or some form of direct transfer would be the right way. In terms of how we can get governments to listen, I think this is something that we all struggle with every policy issue. Hopefully governments are not just looking to, like I said, what's happening in the West to try and emulate best practice. There's no such thing here. Everything is very much dependent on ground realities and local conditions. Everyone is struggling in the dark, given the huge amount of uncertainty associated with the spread of this virus. But I think what we need to remember is that while there's uncertainty in terms of the impacts of our response measures, there is less uncertainty about the impacts of those measures in terms of their costs. The benefits may be unclear still, but the costs are very real already. So, and those costs are going to rise very sharply the longer these measures are in place. So we need to be able to reassess regularly, looking at how these curtailment measures like lockdowns are affecting different communities and whether in fact they are justified. There are other options that are less costly and may have similar benefits, and that's what we need to do on a regular basis. So I'll stop there. Thank you. I don't think we can hear you.
Thank you, Jayant. Yes, and Carmelo, you have the time to close, and I think maybe you can also answer Adli's question that's not yet answered about the possibility of our consumption being at its peak in the Malaysian economy. What do you think about that? And then also your closing remarks.
Yeah, okay. Regarding government engagement, I think that in general in Malaysia there are good opportunities, and the government is quite at least compared to other countries, quite involved with the civil society. Me personally, in this moment, I'm engaged with Menteri Besar Selangor to do a report on livestock supply chain and the effects of COVID. So they are quite keen to listen. My only concern is that the time of research is probably too long compared to what we are experiencing now, and that probably, like Jayant suggested, we should imply more, we should reason more on cold blood and thinking about cost benefits, even without not having all the data, but having quite a lot of the possibility to follow common sense in this situation and the examples around the world that produce so far the best results. Regarding Adli question, I would not make now a matter of numbers, because of course if we boost consumption, GDP will go up. But as you know, I've always been quite skeptical about the value of these numbers per se. So if we boost consumption, spending on something that people don't need just for the sake of spending, yes, the GDP will go up, but I'm not sure if you are going to gain a real benefit. And consider that Malaysian GDP is already mainly made up of consumption, while the weakness of the Malaysian GDP has been historically the low level of private investment. And in the current scenario, we are eroding the part of Malaysian GDP that was already the weakest one. So that is where we should pay more attention now rather than consumption. So, thank you.
Okay. All right. Thank you, Carmelo. And Chris, you get the last word. And also, I think you're going to answer that question about the impact of weakening USD currency and the drop of oil prices. Also talk about the government's reactions, perhaps, on how do you think they would take any of our recommendations here.
So I'll start off with the oil price question. I think that's an important question because the assumption that's going around is that if there's a drop, a 10 US dollar drop in Brent crude oil prices, it will result in a 3 billion ringgit slash in our government revenue. And we have seen that I think the government's assumption when they came up with the 2020 budget was about 50 to 60 billion. And now I think oil price is hovering around 20 to 30 billion. So that means it's already a loss of about 4 times 3, about 12 B of our revenue. Some people will argue, but we have savings in terms of the fuel subsidy, which is about 4 to 5 B. But I think in terms of the net effect on government's fiscal position, it is still negative. So I think that's when I want to link to my sort of closing remark to say that, therefore, I think on the revenue side, we're a bit limited in terms of wanting to raise revenue at this stage to fund the different kind of short-term needs. But we should be looking at reallocating existing budget to what is considered critical at this stage. Because in the budget 2020, the amount that was allocated is 297 billion, which is a huge amount. And we are only currently at the first quarter of 2020. That means the expenditure would not have been big. So we still have a lot of scope to actually move some of these resources from what is perhaps at this time not critical to fund those things which are actually more urgent at this stage. And I want to say that in this sense, I want to respond to Carmelo's point about the mass testing, which I agree, because I think mass testing is important. And I think Ministry of Health has also said that they will ramp up mass testing to about 16,000 tests per day. And I think where I disagree is that I don't see this as a trade-off between what we need to do in terms of the health side and also what we need to do in terms of the economy side. I think we need to put in place a coherent package which address both the economic side in terms of unemployment and all that, as well as in terms of measures to contain the infection. So I see this as going hand in hand. And I think in terms of government's response, I think the issue right now is not that they have not heard the views and the ideas out there. I think it's quite clear. Many economists have spoken up. A lot of things are said in social media and whatnot. And I'm sure different people have different ways of submitting their input to the working groups. So I think the real challenge now is not whether they have listened or heard, but whether, for example, if you want to reallocate funds, because this was tabled in the parliament last year and approved there, whether do we need to convene another parliament setting or not to approve a reallocation? And I think that is a question that requires, a solution that requires us to rise above politics at this stage, some of these constraints. And I think that for me is some of the more painful decisions that we need to make at this point. So it's about making painful decisions, not just about whether they're listening or not.
Okay, thank you, Chris, for your final remarks. And it's at 12:36 p.m. now. We are just 6 minutes overrun, which is pretty good, I think, for our first webinar. I'd like to thank once again Christopher from KRI, Rachel Gong from KRI, Carmelo, Ferlito, and Dr. Jayant Menon, both IDEAS fellows, but also have their respective institutions. Thank you all for joining us. And I think just in short, well, the first thing is that we're all going to be looking out for Malaysia's government stimulus package announcement this afternoon. We would like to see whether some of these funds are going to be reallocated, as you say, and whether Parliament will actually have to be reconvened for that purpose. Bearing in mind also that Malaysia is going through another set of political challenges. So when Parliament reconvenes, we also understand that there will be some tensions there. And I think today's discussion has really brought home the existing challenges of government in balancing, its fiscal demands, meeting the health demands at the moment, which are probably the priority. And finally, how do we keep our businesses going and the supply chain of trade, and especially within the food supply chain going. So with that, thank you everyone for joining us. And I believe the recording will be made available on our website shortly. we can all leave now. Thank you. Have a good day.
Bye. Thank you, everybody.
Thank you.
Bye. Thanks.
Bye.
Bye.